Hi, everyone, and welcome to the SRHM podcast, which explores new research and emerging trends in the field of sexual and reproductive health and rights, with a focus on using rights-based knowledge for action. My name is Nina Sun, and I am an associate editor for the SRHM Journal.
Good morning, good afternoon, good evening. For those who are listening to this podcast today, I'm Esther Kishmördi, Chief Executive of Sexual and Reproductive Health Matters, and I'm here with Morgan Carpenter, who is joining us from Australia, and Mauro Cabral Grinspan, who is joining us, I believe, in Brussels today. Hi, Morgan. Hi, Mauro.
Hi, Esther.
Hi, Esther. Great to be here.
So we are here between Intersex Awareness Day and Intersex Day of Solidarity. And I thought it would be really great to reflect about intersex human rights, the movement with you, Mauro, who is SRHM's editorial advisory board member, a longtime colleague, and Morgan, who is also in so many ways through your articles that we have been published and many conversations we had to reflect about these days, about the movement and intersex human rights today. Before we are getting into the conversations and the questions, can I ask both of you to introduce yourself and how you relate to the intersex human rights movement personally, professionally? Morgan, can I start with you?
Thank you, Esther. So today, I guess I'm an associate professor in the University of Sydney School of Public Health, where I'm a bioethicist and I run a research project. But I'm also the executive director of Intersex Human Rights Australia, which is a community organization that promotes the health and human rights of people with innate variations of sex characteristics or intersex variations through advocacy and through psychosocial support services. And I bring lived experience to the table. I'm a co-founder of what's now Intersex Human Rights Australia. Oh, and my first ever peer-reviewed journal article was in Reproductive Health Matters. So thank you.
Thank you so much for being here today, Morgan. Mauro?
I am Mauro Cabral Grinspan. I am Argentinian, currently living in Brussels, and right now in Brussels. I work from here with Morgan and Intersex Human Rights Australia, leading our project on intersex depathologization, work that Morgan and I started doing together, well, almost a decade ago. And I have been involved with intersex activism since the end of the 90s, so it has been a quite long time, working in Latin America, but also working internationally, particularly at the UN and in relation with the World Health Organization. So this is where I am right now.
We have been working together mainly in the international space. Both of you are working internationally, regionally, locally with communities as well. I feel that at the international human rights space, I have never seen such a huge development in the recognition of human rights of intersex people. Truly and honestly, through the work of you and your colleagues, bringing, for example, testimonies to the Human Rights Council and to WHO that I think completely changed the discourse internationally. But it's a very diverse space, the international, regional, and local, and it's changing so quickly. How do you see the recognition, and you can go between international, regional, local, how do you see the reflection of recognition, the opportunities, the challenges we can go, but how do you see that, how the recognition of human rights evolved in this area over the past 2 decades or 3 decades since you are working on it?
Thank you for the question. I think the intersex movement has existed for perhaps 3 decades, perhaps a little bit longer. it's grown quite rapidly, but only grown rapidly, I think, in the last few years with the benefit of some resourcing from a first ever human rights fund that's willing to fund the intersex movement. And I think the movement has taken some time to grow, largely because of a lack of comprehension of who people with intersex variations are, and a lack of resourcing for people to work on intersex-specific issues. And I think looking back to the 1990s, the activists that were around then, including Mauro, who's here today. Mauro's got such a long and deep history of work in this space that I think is really incredibly admirable and wonderful. It's wonderful to work with him. And that history, I think, really creates a depth of understanding of the issues and of the spaces that we're working in that helps really, I think, to engage with international institutions effectively. But anyway, I mean, I've gotten a bit sidetracked by that bit of history. Really, I think that the movement started very slowly in a few places with people coming together for the first time, often people who didn't know anybody else, were looking for people, particularly online, but initially also in other methods as well, through queer organizations or trans organizations or women's organizations, trying to find other people with similar lived experience and trying to make sense of our own bodies. And I think when you meet other people, that's when you begin to see that the issues that you faced are often systemic ones and issues that are shared too many times. And that's the point where many people begin to engage in advocacy to try and make sure that other people aren't faced with the same problems. And the kind of problems I'm talking about there are really forced and coercive medical interventions that take place before people are able to consent to treatment. I think that's one of the biggest, most intractable issues we face. But we also face incomprehension, stigmatization, and a whole range of other issues. So yeah, the movement had to begin very slowly by people reaching out to each other, and it's grown and snowballed and benefited in recent years from funding from a small but increasing number of organizations, philanthropic organizations willing to fund work in this space. I think the lack of funding historically has been one of the big barriers that we've faced in trying to grow. But maybe Mauro has a lot more to say about that.
Mauro, before we go, I can imagine that you have a lot of thoughts, but it's also my reflection that I think when you and me started to work first on intersex issues was on the WHO and interagency for elimination of forced sterilization statement. And I think it was a big thing to put a paragraph, and then actually that paragraph grew into recommendations in the first elimination of forced sterilization statement by WHO. But since then, the international recognition grew, but the struggle remained in many ways. How do you see that kind of dynamics, both internationally, but you are also have been working in Latin America, in Argentina, you are very closely connected to the movement. How do you see the dynamics in the past, 10, 15, 20 years?
I think that we face different challenges that our movement has been trying or struggling to overcome. And in some cases, we have overcome them. And that's why, well, in some areas, we are winning. I would say that the inclusion of the I in the acronym LGBTI helped to introduce intersex issues, but at the same time, make intersex issues to always be relegated to the last letter and to people to believe that if LGBT people were in the room, intersex people were properly represented. And for many years, I would say decades, we have struggled to get our allies to understand that even when there is some overlap between LGBT issues and intersex issues, it doesn't mean that anytime the sexual orientation, gender identity, and gender expressions are included, it means the sex characteristics or or intersex issues are included, then I agree with you that having intersex people sharing our experiences have been important to move the needle. But at the same time, we have had to fight to get our allies to acknowledge that we not only have lived experience, we are also experts, and not experts in our own lives. Some of us are experts in tracking and monitoring and reporting on human rights violations, and putting together being intersex and being an expert is still extremely difficult. I agree with you about the inclusion of intersex, but I also remember being the only intersex person in the room and how extremely difficult it is to be alone in certain processes, and how insufficient those processes are when considered from the perspective of the movement. So I believe that something that we have been struggled from the first moment and is still in the horizon is the mainstreaming of intersex issues across the entire spectrum. I believe that when Morgan and I co-wrote a text for a publication made by the former independent expert on torture on intersex issues from a gender violence perspective, some people were surprised, like, why are you putting something that belongs to a different framework in connection with torture, in connection to gender, etc.? But actually, there is an intrinsic connection that we can prove, but also really intersex issues or issues affecting people with innate variations of sex characteristics need to be mainstreaming in the entire human rights system. That's still not happening for different reasons. One of them is still this policy of one is enough. So inviting one expert who also can provide testimony, it's enough to make a meeting, a report, a process intersex inclusive. And we are seeing the outcomes of that policy. We see that it's extremely difficult to work when you are the only one in the room, and when you are in an absolute minority, if intersex people are included
even present
at all. So it doesn't help. And we are seeing that now that we have more people and we are more visible, suddenly there are more allies that they're getting to have a better understanding of intersex people. And sometimes I get that kind of compliment, like quotation marks, that we are getting better at explaining. And you know how those spaces are, you need to keep smiling without getting angry at people. But what is actually happening is that many people, including donors, diplomats, people working at the World Health Organization, they are exposing themselves to more intersex people, and then intersex issues are becoming closer to them. So it has been a long process, but here we are.
I think it's also true to say, though, that there's a saying that the future has arrived, but it's unevenly distributed. So, I mean, I don't know about you, Mauro, but I mean, I can still find myself frequently in policy spaces where I'm the only intersex person present, and where the issues that I want to raise have dropped off the end of a list that's focused on people with a marginalized identity, particularly a sexual orientation or a gender identity. So yeah, I completely agree with your analysis. I think we are succeeding in seeing the issues that the intersex movement is raising being addressed. We are seeing a significant difference. And the ability to publish in peer-reviewed journals is a significant part of that process too, because that's evidence and that's analysis that comes from people in the movement without being filtered by other voices. But we do also still see, I think, other ideas of who intersex people are that can often get in the way of engagement with the public or with policymakers particularly. And I'm thinking here, that there is still a very strong dominant medical discourse that says that we are people with disorders of sex development or differences of sex development. And that framework is associated with early medical interventions to make our bodies fit, ideas about how girls and boys, women or men should appear and function. And at the same time, I think that association with LGBT issues means that a lot of people see intersex as being something about adults with a particular kind of identity. And that assumption that Mauro has talked about, that the action that they're progressing for LGBT people is going to trickle down and benefit our population as well. And those two approaches are radically different to each other. They have radically different understandings of who we are, how we should be treated, when we should be treated, whether we're an identity, whether we're a body, whether we're an infant or an adult. And I think a lot of our work is ultimately trying to make people see the whole picture, really, and make people try and think about what happens to us across the whole lifespan and try and develop a kind of a coherent understanding of who we are that can attend to the actual issues that we're articulating ourselves as a movement.
It reminds me of a conversation partly what we have. I think it was Jakarta Plus 10, Mauro, when you were very fond of one particular principle as well around the right to the truth. That was a very new concept and was so relevant. And I think you brought it up in relation, and especially in relation to intersex issues. But I would like to stay with what Morgan said for a moment. In your introduction, Mauro said that you are working together with others and with Morgan as well for a long time now on intersex depathologization. Could you just say a couple of words about this work and how is it going?
Well, intersex people, intersex bodies have been pathologized, I wouldn't say forever, but I believe that all the people that are living on Earth right now and their parents are also the grandparents. They have lived, and beyond, they have lived in a world where being intersex is considered to be a disorder or a pathology or some sort of disease. What we are doing, we're trying to address these issues from different entry points. One of these entry points is analyzing what the World Health Organization is saying about intersex, and especially that WHO document called the International Classification of Diseases. And the goal is not to delete all references to intersex bodies, which actually they are not mentioned like intersex. We are trying to get rid of a very dangerous language that was introduced in 2019, the language on disorders of sex development, which is a language that was coined back in 2006, that is increasing the pathologization of innate variations of sex characteristics. And we want to change other language there, so to ensure that intersex people keep having access to healthcare without language there that is pathologizing variation of sex characteristics, and that can be used to justify the normalizing interventions that Morgan was mentioning before. But we are also, engaging with UN mechanisms to denounce the different forms in which intersex pathologization is linked to human rights violations, particularly in medical settings. And we're also very interested in tracking what is happening with legal reform and how different laws and policies focus on intersex issues could help to depathologize intersex people, or they are producing sometimes negative effects. Coming back to your question for a second, Esther, I think that, and to something that Morgan already mentioned, one of the challenges that I believe that the intersex movement faces at the international level is how difficult it's for the human rights system to interrogate medicine and medical practices, or I will say the kind of immunity that medical practitioners and medical institutions and medical knowledge seems to have when it comes to be about human rights standards. So something that we see is that many allies trying to approach intersex issues from perspectives that avoid touching medicine and medical privileges. So they try to regulate intersex by legally recognizing a third sex, or trying to avoid sex assignment at birth for intersex children. They want to take legal measures that in some cases could be necessary, for example, non-discrimination, but because they refuse, or because they can't, or because it's really hard to dismantle the medical system and the way it is treating intersex. And we need people to understand that it's not enough to understanding intersex people, intersex issues, and connect them with human rights framework, human rights violations based on variations of sex characteristics. But it's also necessary to acknowledge that something serious needs to happen in the medical system. Otherwise, change won't work. And actually, that's a big question. Going back to the report that you mentioned from WHO, how is possible that an institution like the World Health Organization could have that consensus statement against forced and coerced sterilization, and then the report on sexual health, human rights, and the law, and having positive language on intersex issues, and at the same time, there are medical practices that still keep violating human rights people. And that has to do with the resistance and the pushback of medicine. And that's part of the work that we are trying to do, that we need the human rights systems at the international level, regional level, national level, to take medical power seriously and to find ways of making medicine accountable for human rights violations against intersex people.
If I just follow that, I mean, look, Mauro, I completely agree. I think fundamentally the demand is for accountability and transparency about medical practices, and a call for regulation of what is a largely unregulated space that depends upon clinical opinion rather than evidence to underpin current and historical practices. I think I want to just go back to something that Mauro said a few minutes ago about the notion that policymakers find it too difficult to deal with that kind of biopower, and that instead try and focus on legal solutions to matters of identity. And I think that's something that we have seen in Australia. And it does feel a little bit like a kind of a bait and switch strategy. You know, what we want is bodily autonomy, but what we're given is this kind of unique legal status that has no impact on medical practices, but is something that governments feel it's within their power and ability to deliver at a relatively low cost. It doesn't take account of the needs of the population, but it also doesn't take account of the diverse identities in the population. So there actually have been some really adverse effects from legal reforms that have tried to characterize our population as inherently non-binary, when so many people are women or men, you know, cisgender or transgender women or men. And everybody's identity needs to be respected, non-binary, binary or not.
So as a kind of, I would love to stay here with you for 2 hours, but we cannot do that. But I would like to, in the last round, to reflect about how do you see that this turbulent politics that is not homogeneous at all. It's not homogeneous at the international level. There are opportunities mentioned at the local level at the same time. Everything is changing, and there are backlashes. There is the anti-rights, there is the anti-gender movement. How do you see the opportunities and the challenges, and what is your focus nowadays of overcome them, go against them? work within them, create new dynamics. Where are you today, and where do you see of going? Where do you put your energy nowadays?
Esther, I mean, you're absolutely right that this is an issue. I think we can see a global turn towards authoritarianism. And I think we can also see what I think is quite a deliberate radicalization of multiple different populations to whereby a lot of people that might have perceived themselves to be on the left are now moving toward the right because of this process of radicalization. So for me, I tend to see the anti-gender movement as serving a purpose of radicalizing people in that way. Mauro may have a very different view than that, but I think that certainly it's contributed to this rise in authoritarianism. That rise in authoritarianism is linked to political movements that have little interest or no interest at all in challenging any kind of authority. And I think authoritarianism believes in authority, and that makes it harder for us to hold any kind of authority, medical authority or other authority to account. So it's a very regressive space that we're in. But I think, like talking about the future, we're in a very uneven landscape. And for example, in Australia, we have a federal system with state and territory governments and a federal government. And there are things that we've been able to do in one space to progress things, while in other spaces we've had regression. So there are often opportunities to do good work and to promote protections, both in healthcare settings and more broadly in some spaces, while in other spaces we're seeing no action, inaction, disinterest, or hostility.
Something that really worries me about these particular times is that the situation is putting a burden on many people and many movements and many institutions at the same time. And when that happens, people don't have the bandwidth, or institutions, and to work on what they consider to be more challenging or more sophisticated issues. And this is very unfortunate, but intersex issues still have those labels attached. So it always seems that we can left behind when times are challenging, and these times are challenging. And what is happening with anti-gender movements or anti-rights movements is that they're forcing many different conversations to go back to basics. And people suddenly don't understand anymore what we mean when we say sex or gender. Everything seems to be confusing and dangerous. People don't want to make ethical decisions because they feel that they can't trust anyone, not even themselves, to know what is right and what is wrong. And they want to engage in what they consider to be more complex conversations. And at the same time, we see the different actors in the anti-gender movements pushing for, to repathologize intersex, but to go even beyond that language of disorders of sex development. They want us to go back to malformations or deformation or to non-existence, because they need to support this idea that sex is binary, natural, and perfect in all cases, unless there is something really wrong and disorder or malformed, unnatural going on. And this idea that sex is binary and then intersex people needs to be fixed meets many times, too many times, progressive actors using intersex to prove that sex is a continuum, and actually that intersex bodies proved that gender diversity is possible. And in a way or another, both of them are contributing to perpetuate the idea that intersex people don't have a voice, that intersex is an object that can be used as a device in the context of an argument, And of course, progressive actors can get angry when we said that kind of things because they want to be very different. But to be very different, you need to act in a different way. And we are seeing how intersex issues are being used on one side and the other of the political spectrum without most actors on one side or the other actually engaging with intersex activists or with intersex issues. That is something extremely concerning. The other extremely concerning point is that this turning of the world to the right, and it's not happening everywhere, but it's happening in enough places, is having an impact and will have an impact on funding. And I'm not talking only about funding for intersex issues, but also funding for sexual and reproductive issues in general, and funding for the institutions leading with human rights issues. There are not money for progressive institutions to work or for human institutions to work. Well, it becomes really impossible to make progress at those institutions. So we are having this conversation in a particular historic time between these two dates, but also just before the presidential elections in the US. And the outcome of those elections, combined with the elections in Europe, future elections, in different countries that are extremely important because of the political weight, but also because they are donor countries, that is going to have an impact in all our movements and commitments. That's also part of the reality of intersex advocacy today. We are working to stop human rights violations against intersex people around the world and to create a new world that is based on the right to truth about the past, but also built upon bodily integrity and decisional autonomy. But all of that depends on factors that are beyond our control or our advocacy, depends on the state of the world as well. Mm-hmm. So that's what I think.
But we are keep going, and I know that very amazing work is coming up from you and different events, and I'm really looking forward to see more, and we are working on it. Pieces in the journal, collaboration with the World Association of Sexual Health. I know that you are doing amazing work that is coming up in 2025-26. So I'm looking forward to have more conversations and bringing more people into these conversations. And I really appreciate that you have been here today. Thank you so much, and congratulations for the amazing work you are doing and who you are. Thank you so much, and see you soon. Thank you.
Thank you. Thanks so much for the interview.
Thank you very much, Esther, and thank you to Sexual and Reproductive Health Matters for giving us the space and for being a place where intersex issues can be addressed, which is a wonderful and very appreciated opportunity for our movement.
Thank you. All the best. Bye.
Bye-bye.
Thanks for joining us for this insightful conversation. Please check the show notes for a link to the SRHM journal, which is available online and open access. Follow us on social media and sign up for our newsletter to receive notifications for new publications. If you're enjoying this podcast, please subscribe, give us a rating, or leave a review. Sharing evidence-based and rights-grounded knowledge is our passion, and it's also critical to support the advocacy and actions that need to be taken to improve SRHR for all. We would very much appreciate it. Thank you for supporting the SRHM podcast, which is produced by our staff. The music was composed by Tiber Christian and Salomon Beautombe.